most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad, hey, physical
Together we are
therapist.
the most famous physical therapists on the internet.
Why, Bob? Why? In our
Sorry,
opinion,
kinda hit
of
you harder
course,
than I
Bob.
planned there.
Right on the
You ever
patella.
get
Right on the patella.
The nuns ever hit you? By the way, we're going to talk about 3 stretches to fix your wrist pain in minutes, including decompression.
Mm-hmm.
If you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go to Bob and Brad, our website.com, and you're going to go to the giveaway section. We're always giving something away. This week, we're giving away some of the actually balance pads. These are really well made.
Yeah.
And really work well for seat cushions too, by the way. If you go to Facebook, you'll find it also pinned at the top of the page.
Mm-hmm.
Short version of us, go Twitter, Instagram, or TikTok.
There you go, Bob.
All right, let's go to work, Brad.
That's right. Okay. Wrist pain. You know, it's one of those things that you're probably going to have wrist pain sooner or later, whether you're an active person and overuse your wrists or just as the aging process goes along. And the reason is we're going to look right away to Sam. Sam, I am. He's our skeleton. But we look at the anatomy of the wrist, and you'll see there's a lot of little bones. There's 8 of them, actually. I'm not going to go through all the names of them, but they're there, and they're all there for a good reason. They all have joint surfaces on them. They have cartilage, and they're synovial fluid, and they allow the wrist to flex, to extend, to ulnar deviate, radial deviate, and make circles. It's a complicated joint. It really does a lot of motions.
It's got to be stable, but yet it has to move too. So that's always a tricky proposition.
Right.
Because, again, you got a lot of joints there.
Exactly. If you think about all the times when you open and close doors, if you're doing some manual work, you're pushing, you're pulling, and it's really that joint, you know, all those bones are really going to work.
Taking a lot of work.
Yeah, a lot of abuse. So what happens is, you know, you can have some swelling in there, and a little bit of swelling in each joint adds up to a lot of pain, a lot of loss of range of motion, a good place for arthritis to set in, you know, as you get into your 50s and 60s, etc. So how do you get rid of it? We need to increase the range of motion.
Right. Not only increase it, but just by doing range of motion without stress on it,
right,
it increases what is called synovial fluid. It's almost like a motor oil,
right,
for the joint.
Right, exactly.
So the natural motor oil.
Right. There is one thing we do want to mention. If you have success with your wrist pain and range of motion, like after you take a shower or in a bath, or if you're washing dishes in warm water, and it consistently feels better, loosens up, feels good, there's an option that even one step above that would be superficial heat,
right?
Water or a typical hot pack, but they make hot packs like this Thermatex.
This is a Thermatex infrared,
far
infrared heating system, and Brad and I. You know, you have one in your house, I have one in my house. Right. This is the one I use actually, and I just keep it in my chair all the time for my back.
Your low back.
It's just a great treatment for my back all night. I'm getting off a tangent here, but the thing about far infrared heat, it penetrates much deeper than normal heat.
Right, right.
So
a normal heating pad will just go as far as we have marked here, just a few millimeters, skin deep essentially.
Right.
Thermatex, the far infrared, if you look at the yellow tape on the rule there, 2.36 inches. It's that deep. Now, if you consider that on your wrist, that's going to heat not only your skin, but all the way through the whole joint.
Right, exactly. So it's going to really provide increased blood flow, which always helps it heal or feel better.
Right. And it's not an aggressive heat. It gets up to about 104 degrees Fahrenheit. And the nice thing about they make one just for the wrist, but I don't see any sense in doing that because this one wraps up just like one of those.
A muff.
Yeah, there you go.
Yeah.
Had one. Well, I didn't. My sister had one. Boys didn't wear them when I was a kid.
That's right.
And you put your hands in here and you get both wrists at once. And not only that, then you have the full
right,
the full pad for your knee, your hip, your back.
Yeah, right.
You know,
it can be used for
it's
anything.
just a
you
great
need
thing.
one. We need a portable battery so you can use it in deer hunting, right?
Ooh.
So you can keep your hands warm.
Oh yeah, it's not far away, and then you can disconnect the cord. That's a nice thing. But anyways, let's go to the exercises, Bob.
Sure.
Because if heat's not, it doesn't seem to change the pain or increase it. Or this, even if you do heat it up, you still want to do the
You wanna move it,
exercises
yes.
actually. So the first one, now these are relatively simple. We've got some tricky ones at the end that are going to be some nice pearls, if you will, to get you going. But just simply extend the wrist and flex it, and just work it back and forth. And start out slow. If it's tight one direction, go. Say it hurts and it's tight this way, don't push it. Just kind of work into it back and forth. And after about 10 repetitions, and it starts to loosen up, then you can give it a little overpressure each time.
As long as it doesn't increase your pain.
Right. If you do
So-
it each time when the pain gets better, clearly improves, then you can go a little bit, but use good judgment.
Some people will do it off the edge of a table.
Sure,
So
yep.
you can support the forearm.
Right.
And yeah, kind of a little pressure on, pressure off,
Yep.
pressure on, pressure off. I heard one instructor say, "Don't enter the pain cave.
Oh,
Stay out of the pain cave."
That's a good way to think
Yeah.
about it. You know, along with wrist, if you got wrists, your fingers are probably a little tight. You may want to work that. I know personally, in my experience, that's what I need to do. But then the next thing you want to do is circles.
Sure.
Not a tight fist, but a loose fist, and you could do it straight or with a fist, whatever works better. And go clockwise. Start out small, and as it feels better, work bigger and bigger. Make sure you go both directions. 10, 15.
I always like that one, Brad, that
repetitions.
you'd show people is you put your fist like this and then you'd twist out like that.
Sure.
I
And that's actually a good stretch for
For
your
the forearm.
Yep.
Right. I just always like that one. It just feels really
Yeah, that's
good.
a nice option. Yeah, we always like to give people a
Yeah.
little more than we
Right.
say. Now, this next one is one I like personally, but it's the decompression or traction.
Sure.
So all these joints, particularly if you're doing a lot of pushing, you want to decompress them, pull them apart, let that synovial fluid be able to get into those joint crevasses, if you will. So just relax. This is a hand I'm going to do the traction on, or the decompression, relax it. This hand's going to grab around the back of the hand, and then I'm going to support the weight of my elbow on my thigh here. You could do this on a table. You probably
Sure.
want to have a towel there so it's comfortable. Here, as a matter of fact, I'm going to use this. Oh yeah, that helps a little bit. And you just relax it. The other hand gently pulls and relax. So you got kind of a pumping motion. It's very slow, and relax. Now, what you can do, and this is one of my little tricks I do when my wrist gets kind of sore and it kind of locks up, so I'll pull and then I'll do some rotation. Can you see that, Mike?
Oh, so the forearm is rotating. You're not rotating the hand.
Exactly.
The forearm rotates.
This hand is
Oh, I could see
stabilizing the
that.
hand.
I could see that. That would work.
And then I'm just rotating the
Excellent.
wrist. And that really gets some nice motion. Can you see that, Mike?
Along with that, I bet you could even just do a little bit of, pushing up and down.
Right,
Yeah, going
exactly.
that-
Yep, you could go up and down this way.
Yeah, move it all.
Yep,
And with all these things, if you find one direction that feels really good,
right,
that's what you want to keep doing.
exactly.
Yeah, 'cause
Exactly.
I want to show the mulligan technique, very similar to this really,
Sure.
to some extent.
Do you want to have it's a nice
Sure.
little rest.
So what you're going to do is I'm going to take my hand, and the thumb is going to push the bones this way,
Sure.
and my fingers are going to push it the other way, provide a counter force. So I go like this, I push it over, and this is pushing that way, and then I do flexion and extension while I'm doing
Oh,
that.
yep. Yeah,
And
this is a typical mulligan
Yeah,
philosophy.
And I've had this where I felt like my wrist needed to be cracked, or there was a kink in it.
Yeah, I know what you mean.
And that's
know
where
what-
I did that one, and I was like, wow, that felt really good.
you
so
you mobilized
I
it.
mobilized it.
There
Right.
you go.
Again, pain free. If
Right.
it hurts, you do not do it.
Right.
But you'll know right away. Does it? Oh, it feels fine. No, it doesn't hurt. Or if it does hurt, you stop.
Yeah.
Very simple.
Exactly, Bob. It's very, very. A lot of these treatments are not that difficult. You just have to understand the concept and don't overdo it. Take the way that is pain free, and there you go.
It's like a hammer. If you keep hitting your thumb and it hurts, stop hitting your thumb with the hammer.
Yeah, then you don't have to take ibuprofen.
That's right. So these things are very simple in life
Well-
if you just follow. Remember, Brad and I can fix just about anything.
Except for
A broken heart.
there you go. But we're working on that.
I don't know. I feel like Brad hasn't been working hard enough on it. It seems like you're slacking.
I know, Bob. But I'm going to work on slacking too.
All right, he's good at that.